Acts of violence are not spread evenly across all workplaces. Rather, violence tends to occur in specific work settings. More than half of all workplace homicides occur in retail or service settings such as convenience stores, taxicab services, and gas stations. Homicide is the leading cause of death in these industries. That's right, the number one cause. About 3/4 of these homicides occurred during robberies. Stores and service industries are particularly vulnerable to violence because they generally involve the exchange of money, working alone or in small numbers, and delivering passengers goods or services. They may also involve working in high crime areas or during late night or early morning hours. All of these factors can increase the risk of violence in any workplace. Although the most common form of violence is crime-related, a significant number of workplace assaults occur where the aggressor has a legitimate business relationship with the victim. In these cases, the attacker may be a client, patient, inmate, or any other individual to whom services are provided. A large proportion of these assaults happen to medical personnel and social workers. In healthcare and drug treatment facilities, nurses are often the target of violent outbursts. Violence in treatment settings is usually caused by clients and occasionally their family members who feel frustrated, vulnerable, and out of control. And what about cases of worker-on-worker violence, the kind that figure prominently in newscasts and headlines? Contrary to popular belief, worker-on-worker violence accounts for only about 8% of workplace homicides. But no industry is immune to this type of violence, since it is usually motivated by interpersonal or work-related disputes. Workplace violence stems from a personal relationship between the attacker and victim. This type of violence spills over from personal life to the workplace. For example, domestic disputes in which the victim is assaulted or threatened while at work. Laws and regulations regarding workplace violence vary by locality. There is no national legislation that specifically addresses workplace violence. OSHA, the Occupational Safety and Health Administration, and NIOSH have published voluntary guidelines and recommendations for taxi services, late-night retail establishments, and healthcare agencies. Only 2 states, California and Washington, have OSHA plans that enforce regulations requiring comprehensive safety programs in all workplaces that address preventing assaults on workers. These states have also enacted specific legislation to protect healthcare workers, such as nurses. Washington, along with Virginia and Florida, has passed state laws aimed at preventing robbery-related homicides in late-night retail establishments such as convenience stores. Local ordinances to protect taxicab drivers from violence can be found in major cities including Los Angeles, Chicago, New York, Boston, Albany, and Baltimore. It's important to note that while the potential to reduce workplace violence is great, there is no conclusive scientific information on which specific approaches are most effective. Research is in progress to determine which interventions are most appropriate for different work environments. Strategies for preventing workplace violence fall into 3 categories: environmental, administrative, and behavioral. Environmental controls are often found in workplaces where cash is exchanged. Measures such as using locked drop safes, keeping small amounts of cash on hand, and posting signs to this effect are used to deter robbery. Accepting credit and debit cards also reduces the amount of available cash, especially in retail settings and taxicabs. Some safety advocates have proposed using prepaid cab fare cards similar to those used in subways. Physical separation of workers from customers and the general public should also be considered. Creating distance between workers and others may reduce the chances of a physical attack. One way to achieve this is to increase the height and depth of counters. Bullet-resistant enclosures and barriers provide physical protection in a range of environments, from taxicabs to emergency rooms and social service agencies. When selecting methods of separation, companies must take into account the need to conduct business in a reasonable fashion. A safety device that is obtrusive or impractical may be self-defeating because it frustrates workers and customers. Visibility and lighting are also important environmental considerations. High-risk areas should be made clearly visible to as many people as possible. Ample outdoor lighting is also essential. Access to the workplace needs to be addressed as well. Obviously, access to work areas by non-employees should be restricted. Some things to consider include the number of entry and exit points, the use of panic bar doors that allow doors to be locked from the outside but still allow exit, and areas on the premises where potential attackers can hide. Keep in mind that a trespasser can be hidden by a variety of environmental characteristics, such as landscaping, signage, and outlying buildings. And of course, there are numerous safety devices on the market to help secure the work environment. For example, closed-circuit cameras, alarms, key card entry systems in fixed workplaces, cell phones and other communication equipment in mobile workplaces, and trouble lights and geographic locating devices in cabs. Administrative controls are workplace policies and practices designed to reduce the risk of violence. Administrative controls include appropriate staffing. Security experts recommend the use of guards or receptionists to screen visitors and otherwise control access to work areas. In retail, service, and healthcare settings, increasing the number of workers on duty at certain times should be considered. Work practices that increase the risk of assault on workers should be thoroughly examined and revised as needed. These practices include carrying money or valuables and disposing of or storing materials in outlying areas of the worksite. Employers should develop an overall policy on workplace violence that has a clear message. Violence will not be tolerated and is never a part of doing business. This policy should provide for reporting violent incidents, threats, and behaviors whether they originate outside the organization or within. Methods for diffusing potentially violent situations and instruction on how to use security devices should be covered. In addition, violence policies should include provisions for medical care and psychological support following a violent incident, as well as training, which brings us to the third violence prevention strategy, behavioral. Providing employees with training in nonviolent response and conflict resolution is believed to reduce the risk that volatile situations will escalate to physical violence. An effective training program will address hazards associated with specific tasks and appropriate prevention strategies. Ensuring that all employees know how to use safety devices properly is also critical. Increased employee knowledge and adherence to administrative controls will result in behavior that contributes to a safer workplace. Any program to prevent workplace violence should incorporate these three strategies. A successful program also requires a commitment by management and active employee involvement. In other words, everyone must be on the prevention team.